Welcome back to the Sunday Business Page.
It's one step on a long road in the fight against AIDS, but significant progress was reported this month when scientists announced that a baby who was born with AIDS virus seems to have been cured with early aggressive medical intervention. CBS's Dr. John LaPook has more now on the remarkable case of this infant.
When the newborn girl was transferred to the University of Mississippi Medical Center in 2010, Dr. Hannah Gay knew her mother was HIV positive. With the infant only 30 hours old, Dr. Gay took the unusual step of using 3 antiviral drugs instead of the usual 1 or 2.
For the high-risk infants, it's a little bit more left to the judgment of the clinician. And in this particular case, there were several factors that made this a higher risk than normal, and I chose to use the 3 drugs.
The baby was treated for 18 months on the drug cocktail.
Her viral load decreased just as we would expect it to on the medications.
After 18 months, the mother stopped the baby's treatment and disappeared. 5 months later, she brought the baby back to the hospital. Tests revealed no evidence of any active virus. Dr. Gay was surprised because the current strategy is to continue medication indefinitely to suppress the virus.
We don't know entirely what to expect. What we're hoping for is that she remains negative throughout the rest of her life.
If this success is repeated in other children, the largest implications could be in developing countries. Around the world, more than 300,000 babies contract the virus from their mothers each year. Dr. Jonathan Jacobs is a specialist.
This is very encouraging, everything that's happened so far, but this person has to be followed for a lot longer to really know what the true effect of this early treatment was.
Prevention of HIV in newborns rather than treatment is by far the best strategy. In the United States, routine HIV screening and treatment of the mother during pregnancy has dramatically lowered the number of babies born with the virus to fewer than 200 each year. Dr. John LaPook, CBS News, New York.
Important AIDS research is also going on at the University of Pittsburgh. We're joined now by Dr. Bernard Macatangay, I want to get that right, Macatangay, an assistant professor of medicine and assistant director at Pitt's Immunology Specialty Lab. Dr. Macatangay attended a conference in Atlanta this month where the news about the Mississippi AIDS case was announced. Welcome, Doctor. It's great to have you on the show.
Thank you. It's a pleasure to be here, John.
I apologize if I massacred that last name of yours.
It's okay.
This conference in Atlanta, this is pretty exciting news, isn't it?
It is. It's the 20th year for this conference, and when we heard that this was going to be one of the late breaker abstracts that was going to be presented, there were a lot of people in that conference room in order for us to, actually it was an abstract presentation. Right. There were a lot of people there wanting to hear what really happened. Are
you skeptical of this, or do you think we're on the right path here?
Well, I think, you know, just like with any, we've been, the AIDS, HIV/AIDS has been a problem for several years, and right now we don't know. No one has been cured yet, except for the Berlin patient that was reported. And so any news about a possible cure is something that's interesting and exciting. But as was mentioned, it's also important to wait still because it's just been a few months. We cannot really say for sure if the baby was cured until we follow her up several years later to see if the virus really isn't seen.
Now, you and others are engaged in research at Pitt to help us with the AIDS virus, to combat it. What specifically are you working on?
Well, personally, right now, we're looking into, there are 2 important things that are important, well, actually 3. One, of course, because of this cure thing that happened with the baby, and of course with that Berlin patient, it has reinvigorated the scientific community. And so we are looking into that as well, but not really cure, but looking at the different cells in the body where the virus might be hiding. And that's very important because once someone stops taking medication, these cells are the ones which actually, the virus rebounds because of these latent cells. So one of the research that we're doing, headed by Dr. John Mellors, who's the chief of our division, is to look at these different cells. Where could the virus be hiding? That's good. So that's one very interesting thing that we're doing right now.
Let me ask you, you know, a lot of folks will be watching the show and will say, AIDS, it's not a big problem in the United States anymore. Is that true?
No, it still is. It's really interesting that, you know, the clinic at the University of Pittsburgh, at UPMC, has been opened in the 80s, and really we still get to see new patients every other week. We still have newly diagnosed patients. So there are probably 1.1 or 1.2 million people infected in the U.S., and about a fifth of them do not know they're infected.
A fifth, 20% of us are walking around infected and we don't know about it.
Yes.
Now, what can we do? What can we do to protect ourselves?
Well, I think one of the most important thing really is to know if you are at risk, to have yourself tested.
Right.
Because I think one of the most important thing really is that if people know they're infected, at least they can go to the clinic or get treatment, and that can decrease the risk of transmission. There's a lot of preventive studies, or there's a lot of research that has been done the past several years, so that we know what the risk factors are for contracting
Right.
HIV. And you know, it's not anything that's new. It's been there, and what we need to do is just be familiar with that.
Well, it's not just, we think of this as a gay problem, but it's not. We know that long ago. We've gone beyond that.
Yes.
Simple things that we can do. I mean, I know I've read the studies. Circumcision would be one.
Circumcision in Africa has shown a decrease in the rate of transmission for people who are circumcised. One of the most important things, just like with this case, is to test every pregnant woman if they have HIV, because just by giving antiretrovirals or the medications to pregnant women can significantly decrease the risk of transmission to the baby.
That's good advice. And then finally, condoms. We do, you know,
condoms. Yes, it's also still,
I guess that's the number one.
It's still very important. But with all these prevention, I mean, condoms can really decrease. But one of the main problems is people using it.
Right.
With any study, if it's not being used, it's not going to work, and so that's a big problem as well.
Well, Doctor, thank you so much for coming in. We could go on and on about this. I think this is a very important issue. Appreciate the great work you're doing out at Pitt.
Thank you so much.
Bernard Macatangay. One of these days I'll get it right. When we return, marketing students at the University of Pittsburgh's College of Business Administration go about the business of fighting hunger. That's another important issue. Stick with us.
The Sunday